So I was pregnant in August. I probably started having symptoms at like the end of September, early October. By Thanksgiving, I'm like a mess. I really I was just coughing. I had no desire to eat, and I was losing so much weight. So sometimes women, when they're pregnant, they don't gain weight right away. But it was just like kind of falling off me. And I just would come home and I would be so listless. And so it's, TV's everything like those Victorian things you see where the person's just like pale and lifeless. You just feel like rolling over and dying. You just feel like this is whatever. You know what I mean? It's really terrible. It really, for me anyway, it really just felt just like being drawn from the inside out. Now, everybody, I think, thought that that was my pregnancy again, because sometimes pregnancy can make you feel pretty terrible too. Eventually, I went to an ear, nose, and throat doctor. I was coughing so much that the TB like kind of went into my throat. It was definitely on my epiglottis, which is like that little trapdoor thingy in your throat. So I was finding it very hard to swallow. And I went to an ear, nose, and throat doctor, and she told me, she was like, I see some damage in your throat. I can't really tell what it is, but there's something there. So my ENT thought that maybe like acid reflux had, damaged my throat a little bit. That can make you cough. So she put me on like an antacid. One time I went to see a doctor, and they asked me if I had a history of eating disorders. And I remember crying that time too, because I was like, they think I'm lying. They think I'm not telling them the truth. I want to eat. So it was really horrible. So as bad as it was to go to the hospital, I was kind of psyched, because I was like, okay, someone is taking this seriously. Maybe this will be it. Maybe I'll get hope. I'm an optimist. I was like, we're going to the hospital. We're going to patch this up. We're going to solve this problem. So they cleared me for an endoscopy. And so when you have an endoscopy, or at least for me, they wanted to put me like completely under. So I was nervous about that, but whatever. At this point, I would have done anything. And so I go in for the endoscopy, and they put me down, and I'm like, I remember I was having like a dream about space, and then all of a sudden, I wake up, and everybody's standing around me like white as a ghost and just shocked. And I lock eyes with my obstetrician, and I'm like, what's going on? And just blood starts coming out of my mouth. And then I went back out again. So when I went in for the endoscopy, they couldn't intubate me because of the tuberculosis, or because of the way my lungs were working or something. So they had to pull me out of being under. And you're not supposed to do that. And it was just crazy, because it was like, I've never had that happen before, where like I'm asleep, I'm awake, everyone's looking at me, I'm out again. I was brought to an ICU. I had a chest x-ray there. This is the first time I've had a chest x-ray. It was in the ICU. And they told me, they were like leaning over me, and they were like, hey, and time had passed. And they were like, you have TB. Everything would have been so much better if they had just found my TB when it was latent. It's hard to pinpoint exactly where I picked it up, and we'll never know. But we assume, I know because I've done advocacy, that my strain was unique in New York City at the time. I don't think most patients get that kind of information about their strain, but I do know that it was unique in New York at the time. So I probably picked it up somewhere else. If we had just caught it, I would have been spared so much grief. My family would have been spared so much grief. My son wouldn't have been exposed to just all these different interventions in the hospital and all the different medications. The whole tuberculosis infection really affected my husband and my son a lot. Overnight, my husband was like a single father. I kind of just I was gone. And he was so worried about taking care of me, and he was always wanting to be in the hospital. So we had to find childcare, anybody we could get. And we have big families that are very loving and close, and that's another way that I'm privileged. But we had friends of family. We had, my son was just kind of bounced around to anybody that we could find that would take care of him. I think it was difficult for my son to be away from me for so long. And all of that would have been completely not a non-factor if I had been treated latently. My son would have been with me the whole time. I would have been able to live my normal life. It would have been like taking any other medication, because I wouldn't have been contagious. It just would have been a much shorter time. And it wouldn't have impacted my job. It wouldn't have impacted where we lived. It wouldn't have impacted my husband. It was just very, very stressful. There would never have been, if I had been treated with a latent infection, there would have been no fear that I would have died, And because my infection was active and because we found it so late and I was in such bad shape, there really was a threat for a good period of time that I was going to die or that I was going to lose the baby. All that would have been gone if I had just been treated when the infection was just an infection and not disease.